today's post, we're going to be talking about some general concepts of your health and well-being, and we're going to be talking about symptoms and what they could mean. The gist of this country is that if you have a symptom, you should take a medication for it, and therefore if you could squash the symptom and get rid of it, you're okay. But getting rid of a symptom does not necessarily mean you're getting the body to function better. So the concept of functional neurology and functional endocrinology and functional medicine, I throw that term around a lot, and we really haven't explained it, but to explain functional anything, what we're looking at is how well the body is functioning, as opposed to looking at the presence or absence of symptoms does not necessarily gauge your health. So you could have no symptoms, and that could be really a sign that you're healthy. There's no crime to feeling good. But you could also have no symptoms and actually be on the verge of death, for that matter. If we use an example of heart disease, some of the very first symptoms of heart disease are fatal heart attacks. Felt great the day before, dropped dead the next day. So having no symptoms didn't necessarily mean they were healthy, and they didn't actually acquire heart disease in a matter of a day or a week. It takes years and years, if not decades, to develop heart disease. So as a result, they're judging their health by how they're feeling, not necessarily being healthy, but being sick. Now, on the other hand, you could have symptoms, and that could mean that you're sick, but you could also have symptoms, and that could mean that you're healthy. In other words, if you went out to eat and you ate something that was not necessarily good, or if it was a tainted piece of meat or a piece of fish that wasn't cooked all the way or something, then the body was reacting to that food. You could create a symptom like vomiting or feeling nauseous or getting diarrhea. Those are symptoms, but those are actually signs that the body's trying to do something healthy for itself. So to get to the bottom of whether you're healthy or not, what you need to assess is how well your body's functioning. So I've used the term functional neurology and functional medicine. We're assessing the body systems, whether it's your nervous system, or in functional medicine, we're looking at all your metabolic issues. We're assessing the function of those areas, determining the system a system assessment of those things in your body to see how well they're functioning, and by determining the function, that's how you're going to determine whether you're doing well or not. That's going to determine whether you're quote-unquote healthier, could be healthier, by improving the function of those things, by whether it be through lifestyle changes or stress management or removing interference on your nervous system. You're going to get your body to function better, and therefore that's what health is. So when you look at the definition of health, it's when all the body parts are working at 100% all the time. It's a state of optimal physically, mentally, and socially, and not merely the absence of disease or infirmity. So if you look up that definition, that's how health is defined. So keep that in mind when you're trying to work with a doctor. Do they understand the concept of function, addressing the functional aspects of your body, and not just looking to see how we can squash your symptoms or get rid of a symptom with a drug, or even with natural medicine by just giving you supplements to help you get rid of a symptom. So there's a difference between what is called natural medicine and functional medicine, in a sense of functional medicine getting your body to function better. So when you're looking for a doctor, hopefully they'll be understanding these concepts, and that will get you on a better road to health. So I'd like to thank you for watching, and make it a great day.